years after the rollout of vaccine mandates that led to the firing of thousands of workers, the Lancet has reported that natural immunity is just as effective as 2 doses of the Moderna or Pfizer vaccine. Cardiologist Dr. Fahmi Farah is joining me on the Scott Sand Show. Dr. Farah, great to have you back on the show. Appreciate your time.
Hey, thank you for having me.
So this is something that a lot of people have said for like literally almost 2 years now, that natural immunity would be just as effective as a vaccine in preventing some of the serious effects of COVID-19. And that's true of many other viruses as well.
Yeah, we do obtain natural immunity over some time. It's, herd immunity. We're seeing some of that with COVID-19, but it's not as effective as the vaccine still, though.
Now, why would that be?
And I'm basing this off of a study. There was a first-time study done by Vanderbilt University that just came out in December, later part of December of 2022, that looked at and compared two groups, looking at those who have been vaccinated and those who have not been vaccinated, and just natural immunity. And it showed that vaccination is still superior because it is still minimizing hospitalization and death rate by as much as 37% in those who are vaccinated.
On the opposite side of that, are you beginning to see, at least there are reports and anecdotal stories about some of the effects of the vaccine on certain people that could make things just as dangerous?
There are some people who have had adverse effects to the vaccine, but overall, going strictly by the data that we are receiving, both from CDC and elsewhere, it's still showing largely the vaccine is beneficial for majority of the people, and the people who are having side effects and adverse effects as a result of the vaccine are still on the minority side.
Yeah, the thing is, and I'm certainly not a doctor, but I do listen to my medical experts. I listen to my doctor as someone who may have some high-risk categories. I'm over 50. I'm overweight. I don't exercise. I'm not exactly in poor health, but I'm certainly not a spectacular specimen of a man either. I've been vaccinated. I got one of the boosters. And if nothing else, I think that through science that we have learned ways to at least reduce the severity of any of the symptoms if I contract COVID-19. Now, I went the entire time of COVID-19 without catching it until I got vaccinated, and then I've had it twice since being vaccinated. Now, both times, very few effects, very few symptoms, just a little bit of fatigue, perhaps some of the fog associated with long COVID. I'm not sure yet. I think we'll learn more about that over time as well. But I would rather be safe than subject myself to worse symptoms than maybe a bad flu.
Yeah, like those who have been vaccinated, they do have lesser symptoms. They can get COVID, of course, still. Vaccination doesn't prevent you from getting the virus. You can still get infected, but it just lessens the severity of it by a lot. It usually is, as you said, it's more like flu in majority, and the most important thing is that it reduces hospitalization and death, so significantly reduces the severity.
Yeah. So again, even with this new information coming out, which is good news, right? I mean, it's good news that natural immunity is as effective as a couple of shots. That's good news, correct?
That is good news, yes, and hopefully over time we will become more and more immune as herd immunity increases. So that's the hope. But as of right now, we're still dependent on the vaccine.
Yeah. Well, do you think that will maintain that reliance on the vaccine over time? Are we still tracking the number of COVID-19 patients across the country?
I believe they are still tracking them, and only time will tell how we will respond to this in the future. But so far, I agree with you. The response is positive. I do believe that the vaccine has helped achieve that in many ways, and only time will tell how well we will do.
As a doctor, have you encountered, and how do you explain and discuss with your patients, Dr. Farah, some of the many, I'm not going to say untruths, many of the myths, I'm not sure what word to use to describe this, but there have certainly been a lot of things that we have learned about our reaction, our response to COVID-19 in the initial months and even year of the pandemic that we've learned were ineffective and didn't help. Yet we're now still asking people to trust us when it comes to things like the vaccine and boosters.
I think in terms of answering that question, we are a little bit better off now than we were when the vaccine first came out, because we do have a couple of years of data now since the vaccine was administered. And based on that data, we can say with a lot of certainty that the vaccine is working for the vast majority, especially and if you watch the news, you can easily see hospitals are not totally full with COVID infected patients, and the death rate has certainly reduced by a lot. So just by that alone, we can tell that vaccine is working. But now we have actually data with studies like the ones I just mentioned that prove that, yes, the vaccine is beneficial. And yes, there are some people who have had adverse events, adverse outcome from it. And that's true for a lot of vaccines, even flu vaccine that we get. A majority of the people should get it because it's life-saving, but some people can still get adverse effects. So that's not really unique to the COVID vaccine.
Dr. Farah, let's look at some of the misinformation or stories that were said to be misinformation over the past year. And as we talk about the effects of the vaccine specifically, what about myocarditis, which we believe would be from the vaccine would be less common than from the infection itself. But is that true? Are we still downplaying concerns about vaccine-related myocarditis?
I don't think it should be downplayed at all. Myocarditis is a serious condition. But again, going back to what we've seen so far, you're right. There have been several cases of myocarditis reported as a result of the vaccine. But when you compare the two, people are getting myocarditis as a result of the virus itself as well. And more people have been affected with myocarditis from being infected with the virus than they have with the vaccine. There are reported cases, again, of myocarditis, but it's not a lot. It's a small fraction.
What about the statement that young people benefit from a vaccine booster? Is that true or misinformation?
I believe everybody benefits from the booster vaccine. The goal here is for people to not get infected with COVID. And I will tell you on that note that those who have been infected with COVID, and this includes a lot of young people, a lot of them have been really, really badly impacted by the virus. They have those who didn't even have very severe cases of COVID. They still have lingering symptoms. There's something called COVID long hauler. It can affect any part of the body, including the heart. And it's become really debilitating for many patients, including young patients. They have arrhythmia, they have heart failure. A lot of them have, just chronic fatigue where they're just not able to function at their baseline. And this is after years of, almost 3 years, some of them that have been infected, and they're still trying to get back into their normal routine after having been infected with COVID. So I do believe that the vaccine helps all groups, all age groups.
Is that a mischaracterization of long COVID, though? I know that the CDC says that 20% of COVID infections can result in long COVID. I got to be honest, there are periods since I've had COVID twice now where it feels like I go into a fog or feel extremely fatigued. But couldn't I just be getting old and tired and working hard and stressed? A study in the United Kingdom found that only 3% of COVID patients had any sort of residual symptoms lasting more than 12 weeks. So that's quite a disparity between the U.S. CDC and the United Kingdom results.
You're right. There could be confounding factors that are that are causing some of that fatigue and some of the other symptoms they're having. But, judging by, these same people, they've lived, for all this time, and suddenly COVID is here, and now they're having a lot of these symptoms, and some of them it's real. It's not something that they're making up, because we have young patients who, like in their 20s, and they're on oxygen now. They can't breathe on their own. So this is real. The people who are actually affected by it, they really are affected. So I think a lot more studies obviously need to be done before we can say definitively what the true impact of COVID is, and what are some of the other things. There's, of course, a psychological impact there as well. So to differentiate that and to get a solid answer, I think we need more time and more studies and more data.
Cardiologist Dr. Fahmi Farah here on the Scott Sands Show. What else have we learned? Are we better prepared today for a severe outbreak of the flu or the next pandemic that may be coming down the line?
There's always worry for a next pandemic. I hope that this pandemic has opened a lot of our eyes to be better prepared. In terms of the flu, that is a concern, because with COVID, it kind of overshadowed flu, and a lot of people were not getting their flu vaccine. And now that, initially people are still protected from the flu just because of all the lockdowns and social distancing and masking. But now that we're coming out of the mask and all of those protection and preventative measures, people not taking their flu vaccine, I think that is a little worrisome. I think we can expect to see more flu infected people with flu in the next year.
One of the concerns I've got, and certainly we are learning that a lot of what we did was wrong. If we look back at some of the ways, some of the shutdowns, especially some of the ridiculous steps that were taken, like I'm thinking specifically of plexiglass in front of cashiers that would still touch everything that you were buying, was a ridiculous thing to do. Or putting the stickers on the ground to stand 6 feet apart, facing backwards in an elevator. I mean, we did some ridiculous things and shut down some ridiculous places like hiking trails and basketball courts because of COVID-19. The science, I think, will eventually prove to be right with regards to how it can be treated. My concern is that there's so much distrust now of the government and of scientists that if another pandemic does pop up, it's going to be even worse, because even fewer people will follow guidelines and instructions next time.
And that's why it's so important for us to be prepared. And, I know when a catastrophe like this hits, we can never be fully prepared, but we were just so underprepared for this one. And I hope that we will all be better prepared if there is a next one. I hope there is not a next one.
No, not during my lifetime, Dr. Farah.
Yes, I think we had enough.
Great to have you on. Appreciate your time as always.
Thank you.